Hi, I want to start off by saying that I appreciate you meeting with me today, and I hope that by the end of this, you will be in support of my proposal. With that being said, let's get started. Health East Care System's vision is to provide optimal care that ensures well-being for their patients, and their promise is to empower their patients and their families to live a better life. This is especially important for patients and/or families that are facing a life-altering diagnosis such as cancer. For this very reason, I am proposing that the Health East Care System implement two of the following trainings. The first is a communication skills training for all medical providers within the oncology field. This will be critical for a patient's well-being. This workshop will give medical providers the necessary tools they can use in their interactions with their patients, which could ultimately provide for a more positive outlook for the patient during a very difficult time. The second training would be an electronic medical records training. For those medical staff that aren't fluent in today's modern technology, this training could provide them with more efficient and productive ways in which to communicate with patients. Both of these trainings could be used to decrease anxiety, depression, and confusion that patients with cancer tend to experience. So why am I so invested in this? I will tell you. In December of 2012, I was diagnosed with brain cancer. The onset of this was a seizure that I had in the middle of the night. Not thinking anything of it, my husband and I left to go to the hospital, and they performed some tests on me. The conclusions of the test determined that I had a malignant tumor in my brain called an oligodendroglioma. I learned that there isn't a cure, but that those with a less threatening form of this tumor, such as mine, are able to live a very long life with this, but that didn't diminish any of the feelings that I was experiencing. Since my initial diagnosis, I have had 2 surgeries, 2 years of chemotherapy, and 1 round of radiation. I have gone through a multitude of emotions such as sadness, depression, and anxiety. And yes, as time has gone on, I have felt optimistic and hopeful at times, but still the underlying feeling is fear, and I still feel that to this day. Throughout all of this, I've interacted with multiple doctors. Some of my interactions with them have been helpful, enabling me to have a more positive outlook. I appreciate those interactions as they have made me strong during a very difficult and emotionally draining time. Also, I attribute these interactions to the medical provider's sense of empathy, a kind and helpful bedside manner, and their intuition into my emotions and lack of medical knowledge. Other interactions have been uncomfortable or even awful, and I feel as though this was in large part due to the doctor dismissing my feelings and not doing their research on my background, ultimately making me feel as if I was just another case. In conclusion, yes, I have been given information that no one ever wants to hear, but I know I'm not the only one. And for patients to be provided with optimal care and to feel empowered during this very emotional and difficult time, it's essential that medical providers be given these very important skills. Thank you.